Tēnā koutou katoa. We'll just wait for people to trickle through, and then once we've feel like we've got everybody here, we'll start the webinar. It's an absolute privilege to have you here this morning, and we're really excited to bring this information to you. Well, morena tatou, I think we can start the session today. I would like to, kia ora, I'm Nikki Jackson, the Director of Alcohol Health Watch. I will start our session today with a karakia to open our webinar, and so te kua, te wairua, kia rere, kina taumata. Hai arahi, ia tatou mahi. Me te tātou whai nā tinganga, a rātou mā, kia mau, kia ita, kia kore ai naro, kia pupuri, kia whakamaua, kia tina, hui e, taiki e. And it is an absolute honour and privilege to present our third webinar in our 4-part series on youth drinking and alcohol harm. And I'm just going to start with my slides, and hopefully they're going to work. All good? Great, okay. So a little bit about this project. It is a partnership between Alcohol Health Watch and the Adolescent Health Research Group. This webinar on Rainbow Young People is part of a much larger project around adolescent drinking and harm, because we have the Youth 2000 survey series, which has obviously got a wealth of information and data that can be examined to look at what's going on for our young people in Aotearoa. So this is obviously the third webinar. We've had the first webinar on drinking patterns and harm in the overall student population. And then last month we had the webinar on rangatahi Māori. This third one today is on Rainbow Young People. And then the fourth one in the series is on Pacifica Young People in February next year. So the way that the webinar will run is that we ask you to be on mute. You can put questions into the chat, and we can either answer them in the chat or we can answer them in the panel discussion that will follow. We're going to kick off with about a 15 to 20 minute presentation, and Dr. Whenoti, John, will run through that, and then we're going to run into a broader panel discussion where we're going to talk about the implications of the findings for school and family-based interventions through to policy and broader social determinant policies, because it's really important where we are right now. Today we're going to have a bill read in Parliament that's finally going to seek to restrict alcohol sales and availability in Aotearoa. And so it's really important that we start informing this policy debate. And we've got a second tranche of law reform that's been looked at in 2023 around alcohol advertising and sponsorship and price of alcohol and online alcohol sales. And we know that these measures also will have an impact upon drinking amongst Rainbow youth. So it's a real timely opportunity to look at these results and see what they mean for the policy windows that are open right now. So we're really grateful to our funders, NIB Foundation and Te Haringa Hauora, for allowing us to dive deep into this data and to produce the fact sheets and the webinars that we're looking at. So we want to acknowledge all the young people that have taken part in all of these youth surveys from 2001 to 7 to 12 to 2019, the schools, the researchers, the analysts that have helped us to get here. We've got a wonderful Rainbow Youth Advisory Group for this project, the biostatisticians and the analysts of today's data. Thank you, Jane and Alice. The authors of a technical report that accompanies the data that we have today. Thank you, Jude, Jane, Catherine, Alice, John, and Bella. And thank you, John, to our amazing presenter this morning, and to our panelists, Tabby and Catherine. So we have a range of fact sheets that we've produced out the series. We've got 4 fact sheets on the overall student drinking, overall student population. We've got a fact sheet on rangatahi Māori, and today we're launching the fact sheet on rainbow adolescents. And so they're available on the Youth 19 website and the Alcohol Health Watch website. In February, we have our webinar on Pacifica young people, and so look out for the fact sheet to come. So that's me, and we're going to kick off now to John, who's going to run us through the findings of the studies.
Kia ora. Thank you so much, Nikki, and just bear with me while I swap the Zoom over, get the slide deck loaded in the projector, as it were, stand by. Kia ora. Hopefully you can see those slides. Oh, great, thanks, Tabby. Kia ora whanau, lovely to be here with you all and to be sharing yet more data from the fabulous Youth 2000 kaupapa, and in particular today from Youth 19 and Youth 2012. So the survey series that keeps on giving. Ko John Whenati Tokungoa. I'm a Pākehā cisgender queer guy. I'm originally from a little place called Makara on the west coast of Te Whanganui-a-Tara in Wellington. And I mainly hail from sort of Irish descendants, but I've been living up in Tāmaki, Makaurau for a few decades now. I've been involved with Youth 2000 actually since the 2007 series, when I was at the time working around cyber safety. So it's neat to be able to present on this data. We're presenting in this webinar just some of the high-level findings, but there's a matching fact sheet that has way more specific detail about all of these things. And if there are any of those questions, hopefully we can kind of cover those off, but they're also covered in the fact sheet. In terms of then drilling down to today and thinking about who are we talking about, we're obviously talking about rainbow young people, and we recognize that rainbow is still quite a contentious term. We're using it here in an umbrella, inclusive way, but that often does obscure some of the differences that exist within that rainbow umbrella. For instance, takatapui, and also in particular, we know there are lots of disparities for trans communities. So just recognizing some of those challenges around the broader rainbow umbrella. In specific, for this seminar, we're talking about those students who are identified in the survey as being trans or gender diverse, or who said they weren't sure of their gender, those who said they were attracted to same or multiple sexes, and or those who said that their sexual orientation was bi, pan, takatapui, gay, lesbian, or something else that was not heterosexual. The sexual orientation question was included in 2019 for the first time. When we look at that whole clumping together, we get 12% of the secondary school students in Youth 19 were part of that rainbow whānau, LGBTQIQ, IQ, and plus. We haven't focused on students that may be asexual. There's particular challenges around identifying those students. So just a caveat to kind of note that there. Because of the way, and many of you working in this space will know how much things have changed in the rainbow space, it means that some of the survey questions make it impossible for us to look at realistic trends over time for the rainbow community. So we haven't analysed those trends in this webinar. One of the big things that we always point out with Youth 19 is that the majority of the students, not all of them, but the majority of them have been recruited from schools. They were at school on the day that the survey was conducted. And that means then that we're getting those young people that are still connected to this really important developmental setting. which means they have access to supports, access to often subsidized or free health-based services. So that we're looking at a more supported, robust population than those who may have been excluded from school, who obviously we haven't included in the survey, given how we recruited those participants. And then we go into to think about the context for alcohol use amongst Rainbow young people. And when we do that, some of the key things that come to mind, and for me and for many of us, will be the inclusivity of the environments in which Rainbow young people occupy. What is happening in their key contexts, where they live, where they work, where they study, that in some ways either awhi and support their identities or produce marginalization, which may have an impact on their experiences of discrimination, and also then how they manage that marginalization, potentially by deploying coping mechanisms that are useful but perhaps not particularly helpful, and using alcohol as a coping mechanism is one that has been around for a very long time, but also comes with particular impacts on mental health. We also know that the context for alcohol use amongst Rainbow young people is affected by higher exposure to violence for Rainbow young people, and we'll look at some of the stats in detail around this, but it's just important to keep that in mind, that that this is that alcohol use for Rainbow communities has a particular contextual context. We also know that that Rainbow communities, people in Rainbow communities, have often used alcohol as a social lubricant. We frequently experience a society which stigmatizes and devalues and pathologizes trans, non-binary, intersex, and Rainbow identities, and often those experiences make it difficult for people to perform their identities, to be open about who they are, and alcohol is often used as a social, we say, as a social lubricant to kind of support those expressions of identity. And equally, the prevalence of alcohol in Rainbow spaces is well documented, and that means that this is also a part of the context for Rainbow young people. It's we don't have a whole bunch of Rainbow young people going to, for instance, a big church setting which doesn't revolve around alcohol, but often some of the main contexts for Rainbow young people do revolve around alcohol. So that's just some of the high level context setting that we wanted to point out. Alongside of this, and I saw in the Zoom a few of you will be really interested in this and have done a lot of work around some of the use of Rainbow identities and advertising alcohol to Rainbow communities, and the plethora of ways in which the Rainbow identities are marketed as a part of an alcohol culture. And I think that's a really interesting kind of thing. And unfortunately, as a community, I think we've got one of the best kind of legs going. So it does make us, I think, even stylistically particularly attractive for this kind of rainbow washing. But it's something that's particularly important to be mindful of how the industry is targeting rainbow communities. So when we jump in then to looking at the findings, and the first findings here come from the 2019 data. So this is collected obviously pre-COVID, and we're presenting here national estimates, although, and that's gone through a statistical process because the data was collected from Waikato, Auckland, and Te Tai Tokoro, so the sort of upper half of the North Island, which gives us some really good spread of key demographics. And what we're looking at here is those drinking patterns, with with 4 out of 10 rainbow students reporting that they had never used alcohol, compared to a slightly higher amount, 46% of non-rainbow participants. 52%, so just over half of rainbow students said they currently used alcohol, compared to a very similar number of non-rainbow students. When we look at this for rainbow students in particular, that graph below talks about how many of them said they used alcohol in the past month. So just over a third used alcohol in the past month, and just under 1 in 10 said they used alcohol weekly. So that's the sort of prevalence levels that we're looking at for that community in 2019. One of the really interesting things that we're interested in is around binge drinking, because we know that's often one of the serious indicators that we need to focus in on. And that was defined as 5 or more drinks in one session. And we see very similar levels of binge drinking between rainbow and non-rainbow participants when we adjust for age, the sex that the participant was assigned at birth, ethnicity, and a measure of deprivation. So similar rates of binge drinking that were there compared to non-rainbow communities. But with 45% of the current drinkers reporting binge drinking at least once a month, it very much shows that there's some particular effort that needs to go into addressing this particular harm that we're seeing. We also looked at around who was at the consumption amounts of rainbow students, and 9% of those rainbow drinkers typically reported consuming around 10 drinks or more in a drinking occasion. While that number is obviously concerning, this is significantly lower than that non-rainbow group who reported drinking 10 or more drinks, with around 14% of those. You'll see from the graph below around sort of the current drinkers where this is sitting. The majority, nearly a half, are drinking 1 or 2 at a drinking occasion, and then that goes up a little bit, and there's that spike, a little spike at between 5 and 9, and then at 9%. So the typical amount is around 1 to 2 drinks for those students. Despite the fact that we're seeing in some ways kind of some similar levels, one of the key findings that we really will spend some time talking about today is the finding that there was a greater harm from alcohol use reported from the 2012 data. The question about alcohol harm wasn't able to be included in the 2019 survey. There's always an issue with surveys around how many questions you can include and how you avoid survey burden and burnout from participants. And unfortunately, alcohol harm was one of the victims of the survey methodology, but we have been able to look back into 2012 to see what's been happening there. You'll see at the bottom of that graph, there were a range of harms that could be reported by participants about their experience of alcohol harm. And what we're doing here is looking at that, particularly for rainbow versus non-rainbow, that table on the right-hand side of the screen. And we tallied up all of the possible harms, and they were assigned a score. And we looked at the cumulative reporting of harm resulting from alcohol use. And you'll see that that mean harm score was 1.65 for the rainbow community, and that is higher than the average score for non-rainbow drinkers. When we looked at that in particular, we saw there's a significantly higher proportion of rainbow drinkers who reported harm from harm in the form of unsafe sex involving no condom, or a report of unwanted sex following their drinking. When we're thinking then, when we look more broadly at the sort of an overall analysis around alcohol harm, one of the things that we want to always kind of come back to is recognizing that rainbow young people have intersectional experiences that are distinct from some young people, but they're also still young people, and many of the same patterns of determinants of harm apply for rainbow young people, including frequency of binge drinking, higher quantities of alcohol that are consumed, and the frequency of alcohol use. Across the whole sample, we saw that younger students and girls are more likely to report greater harm from alcohol at the same level of consumption. And the contexts of alcohol use and supervision and support and the social norms that surround alcohol use play a key role in determining alcohol harm. For rainbow students, when we kind of take that context and then apply that to rainbow students, we saw that part of that context is still a large proportion of parents were reported by students as having given the alcohol to them, half of them, and then a very high proportion, 45%, said that friends had given them alcohol. Just under a quarter said that they had recruited someone else to buy alcohol for them, and 1 in 10 had sort of managed to buy it themselves. Siblings were a distinct group that we assessed to see if they'd given it to young people, and 14% said that their siblings had given it to them. Another adult that they knew made up 16% who had experienced that, and 22% had got alcohol from home without permission, and 4% had taken it or stolen it from somewhere else, not from home. So some very obvious kind of sources of alcohol, and then a sprinkling of other sources that are reported by this population. When we then explored some of the risk factors for high-risk drinking, and we wanted to see what those risk factors were for rainbow young people, and how they compared to non-rainbow young people. And there's some, one of the reasons why we included all of these risk factors here is to highlight the general kind of cis heteronormative context that faces rainbow young people. Across many indicators, rainbow young people face disparities compared to cisgender heterosexual peers. And you'll see from the graph there, but what we really want to draw your attention to are the bolded figures, which highlight those factors that were more likely to show high-risk drinking patterns for rainbow students than those who did not report those factors. The past or present CIFS or oranga tamariki involvement was related to a 2 times higher odds of likelihood of a high-risk drinking compared to rainbow young people who did not have CIFS or OT involvement, and another twice higher odds risk of high-risk drinking for young people who reported an experience of sexual abuse. And what's really important is this was also a risk factor for non-rainbow young people, but you'll notice in this table that 35% of the rainbow young people reported this compared to 16% of non-rainbow young people. So there are 2 comparisons going on here. This is a significant issue for both populations, but we're also seeing much higher rates of rainbow young people reporting both prior and present CIFS and OT involvement and sexual abuse, and these are both factors for high-risk drinking. When we explored protective factors, this slide shows the prevalence of those factors in rainbow and non-rainbow students. And we see some of the key differences around quality time with family and whānau, feeling safe at home, their reports of feeling that they belonged at school, and also whether or not they said they felt safe in their neighbourhood. The bolded ones here are those factors, again, that were significantly protective against high-risk drinking patterns. So rainbow young people who didn't have those factors had an increased likelihood of high-risk drinking patterns compared to rainbow students who did have those protective factors. And in this kōrero, we'll be drilling down a bit more into what it means when we see the disparities in these rainbow factors across some of these key domains of family, of neighbourhood, of home, of school. They're all part of this mix of rainbow drinking and harm. So bringing it all together, some of the conclusions that are really interesting from this data are that we're seeing similar prevalence of binge drinking between rainbow and non-rainbow youth. And actually that the rainbow youth in this sample were significantly less likely to consume 10 or more drinks on a typical drinking occasion. However, rainbow young people are significantly more likely to experience high levels of alcohol-related harm, especially sexual harm. We know that supportive family and school environments are important to reduce harm in the data in a range of domains, and the data shows that's also the case, seems to be the case here for alcohol-related harm. There are high levels of reported sexual abuse in the sample, and this is also associated with increased likelihood of high-risk drinking. There are a range of approaches that we think are required to address to reduce the harm, and it's really important that, as the saying goes, nothing about us without us. It's really important, and it's fabulous to see so many rainbow whānau in the Zoom today, that we ensure that the approaches we take are informed by rainbow young people to ensure that we're actually addressing the issues that are most important and most relevant. So thank you for your patience as we kind of presented a very high level kind of finding. As I said, some of these data will be available in the fact sheet and also in the technical brief that goes along this. But hopefully that conclusion slide will give you some of the key kind of anchors for the panel discussion that Nikki is kindly going to chair for us now. So Nikki, I'll hand over to you.
Sure. Thank you, John. You can stop sharing if you like, and we'll open up the Zoom. So first and foremost, my apologies. I did write those slides and I had my numbers of alcohol harm scores on the wrong way. Apologies. And you can see there in the chat room.
Right. I'm glad you picked up on that. Yes. I was like, is that the right way? So glad that you can clarify that. Yeah,
you can see there, significantly higher average harm score of 2.9 for rainbow young people versus 1.8 for non-rainbow after adjustment and that was significant after adjustment for a range of variables. So apologies, but it is correct in the fact sheet. It's correct in the technical report. So please use the resources that are out there. So as John said, it's a privilege to now host the panel, and we have three amazing panelists. You've already met John, senior lecturer at the University of Auckland, who has extensive involvement in surveys of young people, who did amazing work last week on breakfast, watching him, really fabulous. We also have Tabby Beasley, who's the managing director of Inside Out, a national charity that provides resources, education and consultation and support for anything concerning rainbow or Takatapui communities. Tabby has just flown back into New Zealand actually, and has just finished a counselling and addictions degree and works part-time as a counsellor with rainbow young people, including those living with alcohol use disorders. And absolute pleasure to also introduce Catherine Anderson, who's a member of our team at Alcohol Health Watch as a health promotion advisor. She has a background working in health promotion and communications at a Rainbow service provider. She is a public health postgraduate student at AUT and has a special interest in how queer people are represented in health statistics and research. So as you saw on the last slide, we're going to discuss the implications of these findings at a whole range of levels. And I'll start with you, Tabby, given that we saw that things that, getting safe at home, having high levels of parental monitoring, having good quality time with your family were really protective around high-risk drinking. What do you think this means in terms of programs and policies that influence families going forward?
Well, kia ora, Nikki. Thank you so much for having me. Yeah, I think one of the things that really struck me was that only 56% of the Rainbow young people felt that they did have quality time with their families, and that was quite a lot lower than non-Rainbow young people. And so I think that sends a really strong message that, for those young people, that is something that's important and that can be a real protective factor. And I think we also saw from those results that many young people are getting alcohol from their parents or older siblings or other adults who might be in their family. So I think those adults who are providing alcohol to young people, they also have a responsibility to ideally then be providing supervision in those drinking environments, or at the very least to be having conversations with their young people about safety, and not just around safe drinking, but also I guess in relation to those statistics we've seen around sexual violence. So I think one thing potentially could be some more resources that support families and adults to have those conversations with young people, or give them guidance on how to provide those as safe as possible kind of drinking environments for young people. And I guess one final thought would just be the importance of those adults being able to have open conversations around sexuality and gender and their young people's identities, and being adults that those young people can trust with those conversations and be open. But again, we need more support for those adults to kind of upskill to be able to have those conversations and get the knowledge that they need as well.
Kia ora. John.
Kia ora. Lovely to see you, Tabby, and thank you for those whakaaro. I just want to kind of piggyback off that if I can too, and just say that it's so interesting when we're thinking about these issues and the primacy actually of whānau and family contexts, that sometimes I think for me as a community psychologist, kind of by training, I often focus on community kind of level stuff. But there is something particularly important about supporting whānau to support their whānau, and to ensure that we start to, I feel like we need to face into the fact that there are disparities for Rainbow young people getting support from their families. And I know that Inside Out does really excellent work. Gender Minorities Aotearoa does, Rainbow Youth does. There needs to be, I think, particular support for parents and caregivers of Rainbow young people to start disrupting some of the entrenched kind of prejudices, I think, that distance that parental support from those young people. And that seems to be doubly the case for trans and non-binary young people who deal not only with often kind of the ideas of homophobia that are applied to trans communities, but then in particular to kind of transphobic kind of realities. And so it's been something I've been thinking a lot about really is how do we provide that? And I think, your point around ensuring that there's good guidance for whānau around what happens when alcohol is at home and how it's being provided is useful. And it probably is going to require also some context setting for those whānau about where Rainbow young people go, which is distinct from non-Rainbow young people, because we know that we're different populations, and while there's still some commonalities, those settings for Rainbow young people are often still centered around alcohol. So some kind of that additional stuff I think would be really interesting to kind of explore. And Tabby or Catherine might pick up on that. But the other wondering I've got too in relation to that is coming back into that peer space as well. And time and again, because rainbow young people don't get similar levels of support from whānau, we know rainbow communities are forced and are really good at finding family outside of parents and caregivers. And consistently peers are turned to by young people to provide support. And often those peers are not well supported themselves with the knowledge and experience they need to support each other. And often they're dealing also themselves with some challenging kind of situations. And I think what would be really interesting is also thinking about what it would look like to kind of empower peers to support each other in this process, and also so that those peers have really clear lines of reporting and guidance available to them, so that when a young person in their peer group is facing challenges, they have someone they trust who is available, that they can go to, who is competent, who can support them to deal with that particular issue. So there's some whakaaro for me to throw into the pot, and totally open to any feedback or critique or anything like that, just offering it out there. Kia ora.
Kia ora. Catherine, do you have anything to add?
Kia ora. Yeah, just to tai toko what John and Tabby have said, having those really open discussions with your children from a young age about future partners and relationships and gender identity, making it really evident really early in life that you live in an inclusive house if possible, and just making sure your young people in your life know that they can be who they want to be in a safe environment. Just on a little bit on the alcohol harm reduction stuff, I think there's some really important things to think about, particularly around mental health and alcohol use. We saw some research come out a little bit earlier in the year around the suicide statistics in using alcohol. And we know disproportionately that rainbow communities are affected by mental health and suicide. So just really having those conversations alongside alcohol use, alongside mental health and those kind of things. And just making sure that your young people have people to go to. And just as Tabby said, absolutely implore parents to reach out for support as well, because those services are there and you don't have to know all the answers, but there are services who will stand along and walk alongside you.
Kia ora. And then we move on to the implications of the findings at the school environment, which is about the sense of belonging. It's about having teachers that care. Tabby, I'll go back to you, because I understand you work a lot in this space.
Yeah, absolutely. Schools, yeah, there's so much that schools could be doing to, create better, safer environments for rainbow young people. Visit our website, insideout.org.nz, and we've got a whole set of resources and a lot of information, videos about young people's experiences, all sorts to kind of help schools through that journey. We can provide professional development for staff and all sorts. So yeah, there's so much that they can do, from those environmental things like providing gender neutral bathrooms, toilets, rainbow support, peer groups within the space, curriculum, just so many things. I think the thing I want to focus on here is around relationships and sexuality education. And I think for all young people, we know that the state of that in Aotearoa at the moment is not meeting the mark, to be kind. And there's such a long way to go. And obviously we do have the government reviewing that and, hopefully improving it over the next few years. But for rainbow young people at the moment, they're pretty much invisible in that curriculum. And so none of their experiences are being reflected back to them. They're not getting any safe sex education. And when we think about those sexual harm statistics, I think sexual violence prevention needs to be a really important part of this conversation, because if we're not doing that prevention work, of course, we're going to unfortunately see these statistics, and they do link, with alcohol. So there's such a massive piece of work there needed to give young people the information that they need. And I think we can also think outside of schools for that, while we wait for the education system to catch up. So at the moment, Inside Out's developing a healthy relationships program for Rainbow Rangatahi, specifically in partnership with Rainbow Youth. So trying to meet those needs that our big systems aren't meeting. Yeah, I think also, of course, I guess effective alcohol education and making sure that, schools are giving young people that information. And again, that there are adults within the school communities that are safe people, Rainbow young people specifically, know that they can talk to. And I think, again, when we think about particularly those sexual harm statistics, there's added barriers to Rainbow young people because potentially not necessarily, I guess, those experiences, we don't know the genders or sexualities of those perpetrators in those situations, but if it is an experience between two Rainbow people, then disclosing that experience may involve outing yourself to your parents, to your teachers, to your friends, to anyone. So create extra stigma and add to these ideas around Rainbow communities that often as part of those that we want to try to make our communities look really good and that it's all happy. And so it can be really hard to talk about those really horrible experiences. So yeah, there's a few things.
Kia ora. I think that leads nicely, Catherine. We heard from Tabby the importance of, evidence-based school alcohol education, which we know is available through Tuturu, which is a program developed specifically for schools in Aotearoa, but that isn't always taken up by schools, is it?
No, and I was absolutely going to touch on that. There's a program that some people may be familiar with in schools called SMASHED, and it fronts as an alcohol harm reduction model for high school students, but it's our aim to have that out of all schools in Aotearoa because it's funded by the industry. It's industry-led, alcohol industry-led funded. So it's kind of there, we're doing this good thing while selling a product that we know causes detrimental harm to communities and young people in Aotearoa. So we'd absolutely advocate to see the end of SMASHED in schools and Tuturu funded and taken up by all schools that it's available to in Aotearoa. And the importance of also those programs being inclusive with their language and the education and things like that. So it's important that programs that are there to create harm reduction in alcohol use are inclusive and include everybody that will come across them.
Kia ora. John, do you have anything to add?
Kia ora, and thank you for everyone for your amazing contributions in the chat. And I'm just grabbing them when I can and see them. And just building on, just chronologically for me and my ADHD brain, building on Tabby's points about the situation for curriculum and sexuality kind of education, and just noting one of the comments too around the not tokenizing experiences around identities. We also know, in addition to comprehensive sexuality education continuing to face significant barriers in Aotearoa following numerous ERO reviews, the Identify survey that I've been involved in, we included specific questions for Rainbow young people about their experiences of sexuality education, and the proportions of participants who said that they'd had effective sexuality education about whakatapui and Pacific identities, MVP, FAFF plus identities, was almost non-existent. And so there's these intersecting experiences that particularly produce harm for minoritized Rainbow communities that are often excluded. So I totally recognize that point, and there's a real issue for us around the provision of comprehensive sexuality education that is culturally responsive to the variety of our experiences, and of course to intersex and trans and non-binary young people as well, who are often excluded from those experiences. I've had the misfortune of doing significant research around unwanted sex in rainbow communities, mainly among men who have sex with men, and just recognizing your points, Tabby, around those particular issues. The Youth 2000 series has always shown that queer men report high levels of sexual unwanted sex and sexual abuse than cis heterosexual men in the sample. And I think that's also something that we have a cultural barrier around recognizing sexual abuse for men, and what that means for rainbow men, including trans guys, around what that means for their masculinity when they experience it, talks to a need for us to kind of address that. And in qualitative research, I'm absolutely aware that alcohol has been involved in those situations and also in coping for those situations. So I think until we can start to really find ways to open up discussion about sexual harm, about how we cultivate communities that are caring and recognize people's ability to not necessarily communicate well, even with all of the best sexuality education in the world, I worry about that in particular. So thanks for those whakaaro. I think that's the key stuff I wanted to add. Thank you.
Kia ora. I mean, and again, you've touched on the aspects of feeling safe in the community. We've seen findings in the survey of a very, very low perception of feeling safe in the neighbourhood. It wasn't a predictor of high-risk drinking, but the prevalence was much lower compared to non-rainbow students. So, Catherine, I'll start with you in this term. What do you think? You know, there are multiple communities that we're talking about here. So what kind of things do these findings mean in terms of what we can do at a community setting?
That's a really good question. It's about, I think sometimes the pride flags go a long way. There's a community in Auckland that had a homophobic attack. Someone was attacked in their community, and their response was to hang rainbow flags everywhere in answer to that. It's about there being serious consequences in some ways for homophobia and transphobia in communities. You know, spaces like Cairo that have for a long time been seen as the safe space in Auckland, we've seen increased homophobic and transphobic attacks in those spaces. It's about making community safe, isn't it? It's about having community and having those safe spaces to have community. And I was thinking about what John was saying just before in terms of this, especially with Maddie's comment about cultural importance. It's really important that we think of the role that colonization and Christianity plays in this, and that for a lot of Pacifica rainbow people, their religion or their faith practice is their tie to their community. It's important that we create spaces in rainbow communities for those people to be able to uphold that practice with respect and love. And it's also that thing, Nikki, about what your community also looks like, isn't it? It's the high, with things we know, like the higher the deprivation score, the more likely you are to have a bottle shop really close to you. It's about empowering communities to object to bottle shops. It could go as far as organisations like Rainbow Youth's Drop-In Centre, which is just off K Road in Auckland, that's a sensitive site, which means no bottle shops can be opened around those spaces. It's also about the structure of how the community looks. So yeah, things like that, looking at the way alcohol advertising is affects our community. We saw it with the rainbow washing. And as John said in the beginning, that really alcohol in the rainbow community is entrenched, and it will take culture change. It's about creating safe spaces. And I was chatting with Max from Auckland Pride a little bit earlier this week, and he said that the findings aren't surprising to us, and it's important for Auckland Pride to provide spaces from that are alcohol free and free from the harms of alcohol for our young people while celebrating Pride. And I know we've talked about sponsorship buyout. It's about also maybe the government, other parties coming to the table and providing the finances where alcohol companies normally do to be able to make those spaces available for queer people across Aotearoa.
Kia ora. Excellent. Can I jump on to John? Do you have anything to add?
I love that, Catherine. I think what was sparking for me too was, and I love Rainbow Youth, and I love that it's so close to K Road, which is really important to me. And one of the things that I think comes through from this kaupapa and from some other work that I've been involved in is creating those spaces for Rainbow young people to have really rich, beautiful environments that they can go to, that are currently captured by commercial venues because of the continual funding deficits that Rainbow communities face. Every one of us working Rainbow issues knows that we do this off the smell of an oily rag. And Tabby and Catherine, you know, being frontline people for so long, you absolutely know what that's like. And I think that's one of the broader contextual things that I'd really love to see is some really rich spaces for Rainbow young people to interact, to have time with each other, to have intergenerational exposure that doesn't revolve around alcohol, because we know that peers and mentors are still, that mentors and role models are still also really important to young people's development. And I just would love to see an Aotearoa which had like these really cool, thriving Rainbow and ally kind of spaces that created some of that space that's needed, because Rainbow young people do need space away from family and whānau, because we know that a high proportion of them don't experience a supportive home environment. So we can't neglect that, but we need to make sure we're giving those young people, I think, safe, beautiful places that show that we respect and love them.
Kia ora. Tabby, do you have anything?
Yeah, you both made such great points. I think building on what John was just saying about that need for those spaces, I think at the moment, a lot of our organisation's time is going into fixing the systems, trying to train the teachers, all of those things to help them do better. That it leaves us not much time to actually be putting on these events or working with the young people. So I think I'd love to see a future where there is more of that possibility. And I think it's also been a really difficult few years with COVID in terms of young people or being able to safely put on events or have those spaces, which would be really interesting to see data from the last few years around this and see what that looks like in that context, because again, there haven't been a lot of those spaces, so young people will be creating their own spaces to come together, often with alcohol. So yeah, I think there's a lot that could be done to provide more alcohol free events and spaces for our young people. I think another really important part around community is community services, NGO and AOD services in particular, and making sure that those are meeting the needs of our Rainbow population specifically. And that can start, as Catherine was talking about, yes, having the visibility, the rainbow flags or something is a great welcoming sign that maybe this is a space that you can bring your full self to or talk about it, but it needs to go further than that. Clinicians need to have training. They need to understand, things like this research and understand the unique issues affecting rainbow populations, and particularly have understandings of how to work, I think, with our trans young people and those from different kind of cultural backgrounds and the different, again, unique challenges that can come with, to be able to provide, culturally appropriate services. But I think those services could be doing to start with is, are they outreaching to rainbow community groups, or making sure that their general outreach is coming across as rainbow inclusive and so on, so that young people do feel that will be a safe, inclusive place to reach out and get that support from. I think, unfortunately, often they don't feel that way.
Kia ora. We've got 5 minutes left, so I'm going to ask the panelists for maybe one or two things at the societal or policy level that may not have a direct impact on alcohol use, but could also address some of these broader determinants that we've talked about, what are your kind of key asks that need to happen at a policy level? Tabby, I'll go back to you.
Ooh, it's hard to bring it down to one or two. I think there's some good work being done around this, but for me, really, the sexual violence prevention work in this country, and that has targeted solutions for rainbow communities and rainbow young people, improving the curriculum, what's taught in our schools. There's lots of work to be done. For example, we're still battling with the hate speech laws and actually outlawing hate speech for rainbow communities, adding gender to the gender identity, so protecting trans and intersex people as well to the Human Rights Act. Things like these that set the precedent for how our communities should be treated and supported across the country helps to reduce that stigma, that discrimination, which then in turn starts to reduce things like alcohol harm. So those are a few from me. Thank you.
Kia ora. Thank you. John.
Kia ora. I think I agree, Tabby, it's so hard to bring it down to one thing. And hopefully, Catherine, I'm not stealing your kind of thunder here, but it always comes back to me around the need for a coordinated multi-level response to these issues. And as Tabby indicated, it's in schooling, it's in sexual violence prevention, it's in healthcare provision. Rainbow communities have frequently been invisible from policy. We've been invisible in research. And until policymakers see us and hear us and take our issues seriously and don't say that we're just anecdotes, we struggle to get cut through. And I think some of the concerns I've got are that we're seeing, and these aren't new statistics, right? This has been happening for decades, that without any coordinated response and a kind of an important need to continually remember that rainbow communities exist in our intersectional brilliance, we continue to be missed out. And so we're seeing the downstream effects of exclusion, of exclusionary policy and practice in housing and health and education and all of these things. And we need to see dedicated responses from all ministries responding to those issues, as well as the civic community sectors that are still have obligations and need to uphold our realities, as well as peers in whānau. It really is a whole of Aotearoa response that I think is needed.
Sure.
Easy.
Catherine.
For me, the first one would be for the government to pass the sale and supply of alcohol changes that we're expecting the first reading of that bill today, and really around restricting, and in the second tranche, which we expect next year sometimes, restricting advertising, especially online, in context of digital communications now, especially around influencers, access to things like Uber Eats, Facebook, and the alcohol advertising around that space, restricting physical availability of alcohol, the number of bottle stores in communities and around spaces, things like that. So the legislative changes for alcohol are really important to me, but also exactly what Tabby and John had said. I think the other thing, and people who have worked with me in the past are probably sick of me hearing this, but including us in things like surveys and this, and for the first time the census, because rainbow communities are constantly on the back foot fighting for funding because we actually don't have real data around counting. That's why this kind of stuff is so important. And again, as John said, working collaboratively across the sector, it's really important to make sure we always have rainbow voices in health policy, people who are working on the ground in the sector, because they know what it's like day to day. That collaborative approach is really important. But yeah, the three best buys of alcohol, availability, price, and advertising, and yeah. Yeah.
Well, I think we've landed on a whole range of recommendations going forward, and I thank all of the panelists for today's discussion, and John for presenting the findings. I encourage everybody to download the fact sheet and share it amongst your networks. There will be an evaluation that will come out shortly after the webinar to gather your feedback. I wish everybody a very merry Merry Christmas and a Happy New Year. I would like to finish with a karakia. I realise that we've just hit 11 o'clock, and so again, thank you for your time. And this webinar has been recorded, is going to be available. So if you've got friends that have missed it, please send them the link, and they can also hear all the amazing discussion that happened today. So I'll just close with the karakia. Kia whakairia te tapu. Kia wātia ai te ara, kia tūriki whakataha ai, kia tūriki whakataha ai, homie, hui, taiki. Kia ora everyone. Merry Christmas.